right? Now, but ventricle will continue to contract. Ventricle will continue to contract, right? It is squeezing the blood. But the point which is very important at that particular moment is that now ventricle will be contracting as a closed chamber. Why? Because as soon as, look here please, as soon as the ventricle started contracting, it shut off back valve. Back door is closed. It has closed the which valve? Mitral valve. But yet the pressure in the ventricle are not so high to open the aortic valve. Due to this reason, now at the pressure of 5, I can say there was star 1 event. What was star 1 event? Closure of mitral valve. And closure of mitral valve produces a sound, right? Closure of the mitral valve produces a sound, and that sound is called first heart sound, S1. Closure of mitral valve will produce the S1, right? S1 is produced by closure of mitral valve on the left side of the heart and closure of the tricuspid valve on the right side of the heart. Is that clear? Now, after that, once this valve is closed and yet this aortic valve is not opened, now ventricle will contract as a closed chamber. Ventricle will contract as a closed chamber. When ventricle is contracting as a closed chamber, pressure in the ventricle start going up, right? And let's suppose the pressure in the ventricle goes up to 80. Now up to the pressure of 80, right, ventricle is contracting as a closed chamber because it has closed the back valve, but it could not open yet the outflow valve, that is aortic valve. And this phase of, and of course, again, the good boys should remember that what was happening during this phase to atrium and what was happening during this phase to aorta. At every phase of cardiac cycle, good students should know that at a particular phase, what happened to input chamber, what happens to pumping chamber, what happens to output chamber. Now, we have discussed only this chamber, that during this phase, only ventricle has taken the pressure enough to close the mitral valve. It progressively took the pressure up, but yet it could not open the aortic valve, right? It means during this phase, ventricle was contracting as a closed chamber, or we simply call this phase, yes, what is the name of this phase? Isovolumetric contraction. This is the phase of ventricular systole. It is the early phase of ventricular systole. Now, why we call it isovolumetric contraction? Because during this phase, do you think any blood is entering into ventricle?
No.
And do you think there's any blood leaving the ventricle?
No.
No. So it means the amount of blood in the ventricle is
The
same throughout this phase. So we say it is isovolumic, right? And size of the ventricle remain also same. So it is isovolumic as well as isometric, or simply we say this stage of ventricular contraction when backward valve are closed and forward valve are yet not open. So ventricle is contracting as a closed chamber and its volume and its size does not changes. But you must remember that during this phase, pressure within the ventricle rapidly increases and it is going to approach the pressure present in aorta. Meanwhile, when this isovolumetric contraction was going on, what was happening to? What was happening in atrium? About atrium if we talk, when atria contracted, then there was, you remember, A phase. This is atrial contraction. And at the onset of ventricular contraction, when mitral valve was bulging into atrium a little bit, there was a little jerk produced here in the pressure. And this is called C wave. So it means if you have a manometer or pressure measuring device in left atrium, when atria contract in this first phase, you will find A wave. But after that, when atrial contraction is finished, A wave goes down, ventricular contraction start, and with the onset of the ventricular contraction, there is a back pressure to atrium, especially mitral valve closes and produces a little bulge in atrium, and that produces a slight increase in the pressure within atrium, and that slight wave is called C wave. That is called C wave. After that, what really happens, that yes, here are your lungs, you know, the blood from the lungs is, venous blood from the lung is coming to where? To the atrium. But because ventricle is contracting, it is keeping the mitral valve closed. So this blood which is coming, it will keep on accumulating in atrium. So it means atrium will work as a tank. Now atrium will work as a tank, and it will keep on accumulating the blood returning from the lungs. Yes, lungs. It will keep on accumulating the blood which is returning from the lungs. Is that right? And of course, when the situation is occurring, look here, there is a wave produced and slightly increased pressure, and this pressure is increasing due to venous return coming from the lungs and accumulating in dilated atrium. Is that right? Now, you must be able to tell what three things are happening during, what are the important events during isovolumetric contraction. You must start like this, that ventricle start contraction, it closes the mitral valve, it keep on building the pressure, but yet it has not opened aortic valve. During the, so there is no volume change and no size change. So we call it isovolumetric contraction of ventricular systole, early part of ventricular systole. But a good student should also mention that what is happening to atrium during this time and what is happening to aorta at that very moment. I told you action pressure has gone up to 81. As soon as it becomes 81, right, pressure in the ventricle become more than aortic. And which valve will open now? Aortic valve. Yes, please. Aortic valve. And when aortic valve will open, what will happen? Blood will start ejecting rapidly from where? From the ventricles. And blood is being pumped where? To aorta. And now, as you know, aorta is what kind of artery? Muscular or elastic? So it will stretch out. Aorta will stretch out. It is receiving the blood. You know, many things when they receive the things, they stretch out. So aorta will stretch out, right? As soon as the aorta will stretch out, advantage of this thing is that with little increase in its pressure, it can accommodate more volume, right? But you know, ventricles are really now very aggressive and they keep on contracting, systole continues, and what really happens that now aortic valve is open, so volume, blood volume from the ventricular chamber is constantly being pushed into aorta. And meanwhile, pressure in the ventricle may reach to the peak of 120. The pressure may reach up to 120. But now listen carefully, that aortic valve is open. So it means now left ventricular chamber and aortic chamber are behaving like a single chamber. So pressure changes which are occurring in the left ventricle will be faithfully transferred to the aorta. So pressure in aorta, which was previously 80, as soon as the valve open, pressure in the ventricle goes up to 120, and of course pressure in aorta will also go to 120. Is that right? And during this phase, the blood is very rapidly being ejected. But you know, nothing lasts forever. Even rapid ejection cannot last forever, you must be knowing. So it has to slow down. So what really happens in the next phase? But before I move on to the next phase, we have to study this phase with three standards. What happened in atria, what is happening into ventricle, what is happening in aorta. We have already discussed what is happening in ventricle. That this is a phase when ventricular pressure is more than aortic pressure, so aortic valve is open and blood is from the ventricle being ejected rapidly into